Hospital Radiology Unit. This is where we work from.
Hello, you're welcome once again to my YouTube channel. My name is Beatrice Chimpi and I'm glad that you've chosen to join me today. If you're an old subscriber, you're highly welcome once again. If you're new, please consider subscribing. This is the space where we do motherhood, marriage, parenting, career, health, finance, beauty and fashion. And in today's video, we are talking about the broad topic in medicine called radiography or medical imaging. And to discuss this topic with me, I'm joined by a great senior medical imaging technologist, Miss Susan Nakalins. You're welcome.
I'm called Susan Nakalins, an imaging profession, an imaging technologist with an experience over 7 years. I'm working here at Case Hospital, the pinnacle of medicine. Welcome.
So, Susan, what is radiography? What is medical imaging? This, branch of medicine where people can't seem to wrap their heads around.
Yeah, as you have said it well, radiography is a branch of medicine that uses imaging, medical imaging, to help in diagnosing disease in human organs and also guide in the process of treatment. As you well know that after imaging, you go back to your doctor after finding disease and the doctor will help in treatment.
Wow. Okay, so what are some of these, modalities in a medical term or equipments that we use in this, sector?
Yeah, here at Case Hospital we have quite many, and if we may start on the examinations that are commonly known, we have an ultrasound, that is an ultrasound scan, and basically in ultrasound, it's like the TV where you go, they put some gel on your stomach, they examine, it will show if you're pregnant, like obstetrical mothers or the pregnant women, they send them for an ultrasound scan. Then we can also see abdominal organs, say the liver, if someone is complaining of pain or they are suspecting a mass, and the doctor will ask for an abdominal scan, whereby we shall look at all the abdominal organs like the kidneys, the spleen, name it all. That is ultrasound. We also have X-rays. Basically in X-rays we are looking at bones, and we also have some specialized examinations that we do here. Say you have a problem with your throat, the doctor may request for an examination and you will be wondering where to go. We do those specialized examinations. Then we have a CT scan, and CT scan basically is like an upgrade of X-ray, where we are going to look at the bones or any pathology that is related on all the human body systems and organs. Then we have an MRI. So we look at MRI, it can also help in diagnosing disease or any pathology. It's on a high end. Then we have other examinations like the breast examinations. That one, we call it mammogram, whereby we rule out all the breast cancers. That's where we go. What else? Like in the country, there are PET scans. Those ones, the PET scans, they'll give you a dye to swallow, and it will help to get where the disease is, to help guide the doctor.
As you've heard from the expert herself about the modalities, these, as she has explained, those are some of the, the modalities we do here in the country, and they are also done here at Case with high-tech machines. So anytime, feel free to walk in and have yourself do any of those examinations if they are required by your doctor from anywhere you are. And right now we are going to go and look at the different machines Because when you talk about them and you don't see them, somehow you may not be able to fathom very well. You're welcome. Come along with us.
Actually, when we are doing the MRI, the operator will be here. That is the imaging technologist will be here, viewing you through that glass. And before you enter that machine, the operator will give you a consent form, and there are some specific things that you should know about an MRI. Because I told you it uses a magnet, that means we do not allow any metallic object to go in. So you'll be asked to remove everything that is metallic, and a series of questions will be given to you before you go in for the MRI. For the CT scan, the operator will be here, and CT does all body organs, the head, the limbs we mean the hands, the legs, the abdomen, all the organs we do, and it is so based in bones. So like here, when you see here, we examined the brain, and most likely patients who come here, those of trauma, those who have had an accident, they bring them here in order to detect any hemorrhage or any blood in the brain, and to look at any fracture that is on the brain. So this is like a skull, and this is how good it is. It will give you the soft tissue, then it will give you the bone, in order to guide the doctor in surgery or any intervention that is going to be done. This is a CT scan or a CT scanner. This is what I've been telling you about. It uses radiation. That's why you will see the warning signs as you are entering the room. You are going to see these aprons, they are protective gears. And basically when we bring our patient here, we put the patient here, and this is the table. So the machine will take the patient in as we are doing the examination, making slices. The slices are like cuts through the body organs as it is generating the images or acquiring images, which can be pushed to the computer for the radiologist to view and make a diagnosis, and even a doctor to look at those specific images. So this is a CT scan.
Thank you, Susan, so much. I know most of our viewers, they see these things in movies. They see people being, they get accidents, they put them on the machines, and the machines move them inside. Guys, we have them here in Uganda. You can come and have yourself a CT scan if requested by your doctor from Case Hospital. Thank you so much.
Every room that is using radiation, you'll find warning signs. These warning signs are to guide you where you are not supposed to enter. So here it is saying controlled room. Because of radiation, that is the radiation sign. You are not supposed to just enter those rooms without someone to take you in. Pregnant women, the pregnant women, we don't allow them in, and we don't examine them unless when the risk outweighs the benefits.
Thank you.
You can go in. So this is an X-ray room. This is an X-ray room, and this one we use it to take all images, especially those people who have had traumas, those people who have pain. So we shall put you on this machine, and we examine you to see if you have gotten any fracture. So this is an X-ray room, and that is the controlled room where the person going to operate will be operating from. And this is the fluoroscopy machine that I once told you, which does those specialized examinations. We can do them here at Case, like the barium swallows, those women who are looking for pregnancies, and we need to check the tubes to assess the tubes. Most people think checking for tubes we only use ultrasound, but also here in X-ray there are those specialized examinations which we do. Fluoroscopy is like real time. They are showing you what the problem as they are capturing images.
Yeah, some of the, like she said, the women who don't give birth, I know some of the viewers have seen them or have ended up in hospitals where they're asking them to do HSGs.
Yes.
So that is what she means by...
That is hysterosalpingography, whereby we are going to assess the cavity and the tubes. This is a mammography. As I told you, these rooms are controlled. So we have access for these rooms. And you see these are warning signs because it is a radiation room. That's why we get access to these rooms. Welcome, fellow ladies. This is a mammography machine. And this, as we had told you, this is a place where we examine our breasts from. So basically the patients that we normally get are patients who are complaining of breast pain, those who have felt something in there like a lump. So those are the patients that we capture and we bring here. And we also do routine screening, like all women that are above 45 years are supposed to do routine screening in order to diagnose any signs or any early signs of cancer. So this is the machine where we press your breast and we take the examinations. Images will be captured and processed such that we are able to find any form of malignancy, anything that is with the breast. And we do not only do it for the women only, also men get breast cancer. And this is where we examine from. To our viewers, three things that I've noted or of great importance. One, you've said people come in when it's really late, when you know they have been home, they have lumps in their breasts and they have not come. Please try to come as early as possible, our fellow women, to hospital when you get any lump. And these mammographies are quite very few in Uganda. We only have two.
We only have two. And the one at Case, it's one of the high-tech, the one at the high end of technology. So if they request for mammography, please find your way to Case Hospital Uganda Road and you get yourself a mammography. And secondly, she has noted that this mammography can also be done on men. So it's not to say that only women, and because it's only entirely a breast modality, it works on only breast, unlike other modalities where we've seen that they can do the eyes, the breast, on an x-ray, you can do the limbs, the chest,
the abdomen.
Yeah, but here we are only considering only breast, right?
Yes.
Yeah. So please find your way and have your your breast checked. Can also someone come to do just a routine?
Yes, we start routine checkup from women that are above 45 and above 40 years plus.
Okay.
So because during that time we expect that those women have stopped the breastfeeding, they are no longer in this reproductive age, they are not pregnant, they have just come to do an examination, an assessment on their breasts to rule out breast cancer.
We're in another place. So Susan, what is this machine? What does it do?
So this is an ultrasound machine, and in ultrasound we don't have radiation, as you all know. So in this, as we said, they send even pregnant women. We come and scan their babies, as you may look at some of the images. Right now we don't have someone to scan, but what the technologist will do will apply gel on the probes and will start the scanning. So basically this is the TV that people talk about as someone is scanning, or wherever there is a swelling or anything. In here we look at all the abdominal tissues, and we also do superficial scans. As I was doing this is a superficial scan for those who have swellings of unknown cause. Please come, we do an ultrasound scan. And for the pregnant women, this is where we enjoy most. We get to see our babies inside us, and we can also perform a 3D. As you look at that image there, you can get colored images. Here we show you your baby in a 3D scan. We are able to perform even that
Wow, thank you. Susan, there's a myth in the community. Women, they are being stopped. You know, we encourage them to do scans at least 3 times in the course of the pregnancy. But when they tell their neighbors tell them, don't do scans on your baby. You did one, that is enough. Because they are putting, those things are going to affect the baby. Is that true that, you know, ultrasound affects babies?
So that is not true. As I had told you earlier, in radiography there is what we call non-ionizing radiation, and there is what we call radiation. So with that, the non-ionizing, this is it, ultrasound and MRI. We don't use any form of radiation. So here you are safe, your baby is safe, you yourself, you are safe, even the person doing the scan is safe. And that's why the obstetrician or the gynecologist will always encourage you to come and do a scan, because as many times as possible. The earlier you detect that you are pregnant, you are supposed to come and do a scan, not to come when it is late, because with this we detect even abnormalities of the unborn child inside there. So if you come late, you will produce a baby with an abnormality, yet they would have done any intervention, or they would have helped you earlier enough. So you can do as many as you can. You can even start assessing yourself before getting pregnant to assess whether you have a uterus, because it is one of the reproductive organs, whether you have the uterus, whether the ovaries are there. Then as soon as you learn that you are pregnant, please come and assess to know where the pregnancy is, instead of getting an ectopic pregnancy or the pregnancy that is outside the uterus, because it is unwanted. It will come out, and we can also lose a life if you don't detect early that pregnancy.
Well, thank you, Susan, so much. Fellow women out there, I know this is a channel for women awareness. Part of this video is to create awareness and to break the myths that people have around radiography, and also to, you know, informative, to inform people what the truth is from the horse's mouth, not from your neighbor's mouth. Ultrasound has no effect. It uses sound waves, you know, to capture, you know, images that are displayed, and then they help in diagnosis, and they help in, you know, in early detection of any kind of diseases. So fellow women, this ultrasound, you know, examination or a branch of radiography entails a lot of things, like she has said. So make use of it. Walk to Case Hospital, ask the doctor, I would want to do an ultrasound, even if you have nothing on you. It is something that, you know, you can do, detect fibroids, detect so many things. Some people are born without uteruses. You're struggling in marriage to conceive, but you don't even know that you don't have a uterus. But you can walk in anytime, before even you get married, or when you're preparing to, you know, to give birth. Walk in and check out how my ovaries doing. Do I even have ovaries? Yeah, all things like that. So thank you so much, Miss Susan.
You're welcome. And what I wanted to tell them more about ultrasound, you hear the word ultrasound, so it means it is using sound, but that sound is beyond the audible sound that you hear. It is beyond human being, the sound they hear. So that is what the sound they use to generate images. As the probe goes onto your skin, it will pass there, it will send the waves through the system, and those waves, ultrasound waves, as they go into your body structure, each body structure has a different thickness of the tissue, so it will echo back such that this person can detect that this is a blood vessel, this is a mass which is not normal inside there.
Chizimba. Thank you, Miss Susan, for your time. It's been a pleasure hosting you on this YouTube channel, and I believe someone's life there has not remained the same. People have been informed, they have been enlightened, and I know their lives will not remain the same. Our viewers, thank you so much for watching. Any last words that you have for someone watching you right now?
Yeah, thank you so much, all our viewers. It has been a pleasure to be part of this interview. We have so many imaging modalities, as you have seen, and some that you have not seen but are used in the treatment. Like we have radiotherapy, that is also a branch of radiography, whereby you go with your cancer, they will mark and treat. We also have that PET scan. It is also part of the interventional. So there are so many things that you can learn in radiography. We have echo scans to check the heart of the baby, or even you who is a client. So radiography, we have schools here in Uganda where you can go where you can take your child for learning radiography. We have Makerere University, we have Mengo, and we also have paramedical school. Those are the only 3 schools that I know in Uganda that train the people you see that take your scans. Thank you.
Thank you so much. Viewers, it's been a pleasure, a wonderful time. I'm so grateful. I want to thank the administration of Case Hospital for allowing this interview, for sponsoring this interview to happen. It's been a pleasure. Thank you for your time. Thank you, Miss Susan. You're a busy person. We've encroached on your working time, but it's a pleasure. Thank you so much for getting some time for me to interview you. And to the viewers, thank you for watching this far. Please consider subscribing, share this video, comment, like, and let's learn together and grow together. Till next time, I've been Beatrice Chimpi here at Case Hospital. Bye.
In talking about radiology, we have also other people whom we work with. We have the radiologists, and these are the people who interpret the images that you have been seeing. They make for you a report, and it is that report that your referring doctor reads and guide on treatment or anything, or any intervention.